Hello. Okay, so for my 18th birthday, I received what I like to think was a gift from the NHS. And it was a letter that stated, "Please find enclosed a copy of your most recent pathology report. This confirms endometriosis, which was excised at the time of your operation." And true to their word, a pathology report was attached with a bunch of terms and measurements that made no sense to me. I didn't even really know what a pathology report was, and looking back, I don't think I really understood what endometriosis was either. But none of that mattered at the time, because all I felt was relief. For those that don't know, endometriosis is a whole body disease where tissue, similar to the lining of the womb, grows elsewhere in the body. So your pelvic area, your chest, brain, skin even. Some of you may be thinking, relief is a bit of an odd reaction for you to have, given that endometriosis can be debilitatingly painful and confirmation was sent to you on your birthday. But to me, it was written proof that what I was experiencing was not all in my head, that I wasn't overdramatic, and that the awful things that I was experiencing had a name, even if it is a name that people constantly mispronounce. I now know that many others with endometriosis have felt the same upon diagnosis. And in hindsight, I do wonder if it was partly this powerful sense of relief and validation that I received through diagnosis that laid some sort of foundation for me to realize that my voice counted. I recognized how fortunate I was to receive a diagnosis at such a young age. Again, something that might seem quite odd to say, but the average diagnostic delay in Wales is 9 years and 11 months, and that's the average. There are many women, girls, and those assigned female at birth that spend the best part or all of their lives experiencing debilitating symptoms like pain, issues with organ functioning, infertility, and more, all without receiving the right care. It can also mean suffering in silence because of the taboo and stigma attached to the condition, or because of the normalization of symptoms, or fighting to be heard but feeling like you're screaming into the void. The effects that endometriosis can have on someone's life can be devastating. And it was the anger that I felt over the disadvantages and suffering faced by those with endometriosis due to lack of recognition, proper care and support that drove me to dedicating my working life to creating positive change for all those with endometriosis. I wanted to get the endometriosis patient voice heard. So after being diagnosed at 18, my symptoms returned whilst I was at university, which led to another surgery. And it was following these additional experiences that I set out to start trying to create change, drawing on my lived experience where I could. When I first started to approach health organisations and people with my ideas for what should change, which often involved how communication can be improved between patients and clinicians, I battled with thoughts like, are people going to think I'm crazy? Does my voice as just one person even matter? And then I met Fair Treatment for the Women of Wales, so FTWW for short, the only patient-led charity in Wales dedicated to women's health equality. And they began to empower me with knowledge and support me to undertake opportunities where the patient voice is valued. With their help, I learned how to manage that internal voice that was saying, nobody cares what you have to say. I then met Professor Jackie Brevan, who involved me in some of the work happening at Cardiff University, as well as other wonderful colleagues within Cardiff and Bangor universities, amazing fellow advocates and change makers, mentors, healthcare professionals and policy makers. I said yes to everything I could and began to further learn, with the help of others, what we need to do to create real change. So when the opportunity came up to undertake a co-produced PhD, so that's a PhD designed by charity FTWW, Professor Jackie Brevan and Professor Jane Noyes, and funded by Health and Care Research Wales, when that came up, I grabbed it with both hands. Since having the opportunity to immerse myself full-time in the worlds of research and advocacy, the work that I've been involved in is centred around the creation and dissemination of reliable information, as well as the communication of and around endometriosis. Namely, this has included the Endometriosis Cymru website and symptom reporting tool. So for a bit of context, a symptom reporting tool is something that can help people track and report their symptoms. The Endo Cymru resources were created with the overarching aim of empowering people with information to help in identifying and managing endometriosis, as well as living with the condition. My PhD aims to evaluate how and whether the Endo Cymru resources are working as they intend to. I've also been involved in various projects and opportunities with FTWW, Cardiff University and Bangor University. and prevalent amongst all those that I learn from and work with are the shared goals to help the public and patients see that their voice matters and to help people feel and be heard in all the spaces that concern them and their health. A way in which we have done this has involved extending public and patient involvement in research to partnership from conception to delivery. So this means that patient voices drive research activity, influencing policy and practice in Wales, and leading to making a difference in society at large. So my PhD is a good example of how we are making this happen where endometriosis is concerned. So as mentioned, it was co-produced with Fair Treatment for the Women of Wales and is being undertaken by someone with lived experience of endometriosis. But it's also going to incorporate patient voices throughout as key stakeholders who get to steer the direction of the research. In fact, this has already begun with the completion of the first study of my PhD, which looked at the use of symptom reporting tools. So again, think things like diaries, apps, anything that you can use to track your symptoms, to support endometriosis identification and management in primary care. Early identification of endometriosis is essential to achieving more timely diagnosis of the condition and reducing the negative impact it can have on one's life. So the patient voice was analysed and incorporated in a variety of layers within the study. So for instance, from the data, we saw that symptom reporting tools can help enhance the patient voice, helping patients and healthcare providers to reach a mutual understanding of patients' endometriosis symptoms. But additionally, patients and public involvement members within Wales enhanced the relevance of these findings by providing their views on the use of symptom reporting tools, but also the research itself as the research was ongoing. My determination to get the endometriosis patient voice heard has manifested into completing research and continuing to explore the worlds of advocacy and policy. And despite exploring these worlds through a specific lens, which is that of endometriosis, these explorations have expanded my mind to further understand the interconnectedness of inequality within the entirety of the female health space and how this intersects with diverse experiences of marginalisation and disparity. This has further consolidated and drove my determination for getting voices heard and for helping people to realise that their voice matters and that together we can learn and we can create change. My view of what it means to be an advocate is completely transformed, and so is my view of research. In starting this journey, if someone said to me that you'll be helping to create change and get voices heard through undertaking research, I don't think I would have believed them. Although I was fortunate enough to attend university, so I studied ancient history, the idea of taking part in and undertaking research concerning healthcare was something that felt just so far removed from me. And I think this was in part because of my narrow view of what research involving health and the experiences of women was. I had this preconception of it being clinical and overly formal and just devoid of valuing the views of patients just as much as the views of healthcare professionals as equal partners in creating positive change. But also, I just did not see myself as someone that could have access to something like a PhD, and it still feels surreal in just so many ways. But the research landscape is transforming, with many funding and academic institutions looking to create more space and opportunities to involve the patient voice as co-designers, co-applicants, and co-producers. Research has always been a means to transform and innovate with the creation of new data and information. But involving those with lived experience beyond that of a research participant combines a new level of empowerment with innovation to create even more impactful change. Endometriosis affects 1 in 10 women, girls, and those assigned female at birth, which is similar to the number of people affected by asthma and diabetes. And I sometimes find it really difficult to comprehend that in 2024, we are still even having to try and create change, given that endometriosis was officially discovered in 1860. And it's been suggested that it was referenced in the Hippocratic text over 2,000 years ago. But here we are. For anyone with suspected or confirmed endometriosis who's just feeling unheard and just tired by it all, although this message also extends to any woman, girl, or person assigned female at birth who's struggling with symptoms that aren't being recognised or managed, I hope I've been able to show, even if just a little bit, that there are spaces where you are heard, where you are seen, and where even though we have a long way to go, change is being created. To all those without endometriosis, the likelihood is that you know someone with endometriosis, unless, of course, you're incredibly antisocial, which if that's the case, then fair enough. But either way, I ask that you go and check out some of the amazing work and research that's happening at the moment. Educate yourself on the condition, or how reasonable adjustments could be made within education or within the workplace, or perhaps on how you can build empathy for somebody suffering with endometriosis. Just create space. We also need your help to continue getting voices heard and much needed research funded. Thank you.